I like to use an extra oral fulcrum, and I'll start on the molars. I have my gauze wrapped around my mirror if I need to wipe. Then I'll head over to the linguals. I like to use my mirror for a little extra illumination. Over here you can also use an extra oral fulcrum if you can't access those areas. Then coming down to the lower. I come in from the mesial and then I just pop right over that tissue to do the distal of the next tooth. Makes it more efficient versus coming in, doing the mesial, then coming out and inserting back in. Just helps the flow a little bit more. Then over to the buccal here. Sometimes I like to count my canines in with the distal of my canines in with my posterior teeth. Now I'm going to switch my instrument and do my anteriors. Just got a little cement on there from her braces, that's why that turned gray right there. Sometimes you can get that off, but sometimes you have to have the dentist smooth it. It's best to start canine to canine so that you don't miss or skip any teeth. If you're starting right in the middle, like on 24 and 25, then you might forget to actually do your canines. She's got a nice lingual bar. What I like to do with lingual bars is just pretend that they're not there and scale everything underneath. Just as if your lingual bar was your contact. If you tip your head down just a little bit, Jessica. You can go back and get the fossas. Now I'm going to do the maxillary arch. Some areas I don't use a hard activation stroke because I'm using an exploratory stroke, and if I feel something, then I'll activate it. Then we'll move to the linguals. Then I'm going to switch up to 12 o'clock and we'll do all the surfaces away on the anteriors. I'm using that finger assisted stroke with the back of my thumb. One thing that's very painful to patients is if you get the instrument stuck right in between the contact. So to prevent that from happening, the stroke that I'm doing is always towards the contact. As I get towards the contact, I do an oblique stroke across the tooth instead of a vertical stroke into that contact. So just go into that contact and come oblique versus pulling straight up. See how oblique it's across the tooth. Then I'll switch my instrument one last time to do the posterior teeth. Turn towards me just a little bit. Using that extraoral fulcrum and indirect vision to access this upper left area. Like I said, sometimes I'll treat those distals of the canines as if they were posterior teeth. You can easily adapt those to your posterior instruments. And right here I pop up and I'll do an opposite arch fulcrum. And then her scaling is complete.